Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. I'm here with one of my wonderful patients, Snow. That's an unusual name. Like, why did your parents name you Snow?
I was actually named after Snow White.
Oh, awesome. You know, and she's quite beautiful, as you are.
Oh, well, thank you. I don't have all those dwarves, though.
Partly why I wanted to talk to you was there are people that have this condition called semicircular dehiscence. So you and I aren't going to talk about like what causes that or whatever, but I will teach on that. So we're going to show that video when I teach on that. And then you've had 3 prolotherapies here, and then the semicircular dehiscence, you've had surgery for it. So why don't you just tell us, like, how did you get diagnosed with that? What symptoms that you might have had with that? And then surgery helped, it didn't help?
Okay. Well, I first got it, I was a forester in my youth, and we were out in the woods, and I sneezed and I held my breath. You know how sometimes you don't want to spray the person next to you? Held my breath, and I heard this little pop.
Okay.
And it had popped the bone inside up under my brain. There's like a shelf your brain sits on. And I didn't know what that was. I just thought, oh, that's weird. And but then my hearing changed. So I started hearing things inside my head, like you could swish your eyeballs left and right, and you could hear them swish, swish, swish.
Right.
I could hear my heartbeat in my ear. So I got used to being able to tell what my pulse was because I could always hear it.
Wow.
It made very loud sound. I started walking very softly because when you would walk, it would reverberate up through your body. Or if you like move your arm and your wrist kind of pops, you could hear it reverberate all through the body. And when I would talk, inside my head, my voice was buzzy sounding. So like if I would sing, it would sound like bzz, 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 you know? So it wasn't really fun to sing anymore.
Yeah.
And then the other thing that would happen was kept losing my balance and falling off to the right. Mm-hmm. So even as a young person, I just went and bought a cane because I kept falling towards the right-hand side.
Yeah.
Didn't really know what it was, but eventually it got worse and worse. Mm-hmm. And I did some internet research, and I saw a TV show about somebody.
Yeah.
And I'm like, that's what I have. So then I found out in order to fix it, you have to cut a hole in your skull. So we put that off a couple years. Well, eventually it progressed, and like the hole got bigger and more holes, and it got to where when my heartbeat would go, my eyes would twist to the right, to the heartbeat. Or if I was in a restaurant and there was music, my eyes would twist to the beat of the music. And that made it very hard to read, very hard to drive, very hard to be around a lot of people, and also caused conductive hearing loss, which I didn't realize how bad it was until after I'd had the surgery. And then I was like hearing sounds like, what is that sound of water? Oh, well, there are pipes in the walls. You're hearing the water go through the walls. And I'm like, I hadn't heard that in years. I forgot it was a thing. So after the surgery.
And that was in 2012.
2012, yeah. I had the surgery in Atlanta, and it was successful, and it corrected a lot of those things. I could hear better. My eyes stopped twisting to the beat of my heartbeat. I missed hearing my heartbeat. I was kind of used to the constant companion. But I had a little problem during surgery in that they had my head twisted this way, and we didn't know at the time I had Ehlers-Danlos. And so my C2 got malrotated, and then that ended up compressing my internal jugulars, which we didn't know what it was back then. We know what it is now. And so my brain pressure got higher and higher, and I was having these terrible headaches. Well, when we went to the doctor to get the staples out, because I had the staples, like a little rainbow of staples here, I looked great with half my head shaved. And I was in really bad shape. And, you know, having had chronic illness all my life, I was used to ignoring pain. Well, I didn't know that was a really bad thing. So he saw that I was in really bad shape in the office, and so they just said, I'm not even calling an ambulance, we're 1 block away, let's load you in the car. And they took me in and they did surgery right away and drilled a hole in the top of my head. So now I have a hole here to fix the hole inside, and then a hole on top to fix the pressure from the other hole. So I'm holy.
You're holy.
I'm holy. But the brain injury from that took a long time to heal. My visual processing is messed up. I see multiple images. My eyes don't converge. The floor is like up at an angle. The walls are warped. If I look at a swimming pool, it looks like the water is piled up in the middle. So it was a lot of work trying to overcome where things are in space. And I can fake it pretty good. You know, if you come to my house, all the pictures are just a little crooked, you know, but my friends come and they'll tip my pictures up to make sure everything's right.
What made you decide to come here? Like, what made you decide to come to Caring Medical? Like, what symptoms did you want us to help?
So, I have had more and more issues over the years with the head pressure coming back, and severe vertigo and brain fog. And you know, I'm a biology teacher, and I was not able to think straight, you know, and I teach anatomy to homeschoolers, and I would like study all day the day before, you know, before a lecture, because my brain would just go, you know, and it took a lot of effort just to try and maintain a minimal level of functionality because of the brain fog. But the headache, the headaches, the dizziness, the not being able to think clearly, and my speech would slow. When the pressure's up, my speech slows down. It slows like this, and it's kind of slurry and garbly, and you know, can't be smart enough to figure out how do you multitask a meal to get everything done. And so my meals were 1-pot meals. You make chili, that's it, you know, and maybe open up a fresh bag of carrots. Here, honey, have a bowl of chili and some, you know, whatever. So just very simple cooking. But I'm able to cook a meal now.
Here, you know, because I haven't actually seen you today. Like, this is the first time I'm seeing you today, and I apologize for running late today, and I thank you so much, because it's late today, and you're still willing to do this, so thank you so much. So, you know, we've done 3 prolos. You're obviously doing some stuff for your curve, so maybe you could tell us what things are better, what things aren't better.
Okay. Well, the brain fog is so much better.
Awesome. Wonderful.
I was to the point where I couldn't balance a checkbook. I couldn't read instructions on how to do something and do it. Driving in traffic, I was very limited. We actually had to move across town about an hour away because I couldn't drive over to visit my daughter. And at that point, she was having to help me grocery shop, vacuum, you know, do any little thing where you have to go to the store, because I was so dizzy I couldn't manage in a store. You know, I had to hold on to the cart or my walking stick and, you know, only look at things like either on the left or the right, because I couldn't look back and forth. And it was just really, really incapacitating. And then when it got real bad, my personality went really flat. And then a lot of my autonomic nervous system things were not working very well.
Like what? What symptoms would you have?
I was severely constipated for like the last 3 years. And now that my right vagus nerve is getting so much better.
Yeah, that's what I have here is just your
yeah.
test results. Like obviously on the
Yeah.
first visit we retest you and like one of your vagus nerves now is doubled in size, and then your jugular veins are still compressed, but they're better. And then let's see.
I'm actually able to sleep now. I could not fall asleep before. So
Okay.
I was up half the night, and when I did lay down, there was not a position I could lay in that didn't block the jugulars or block a nerve. So I was having the shooting pains across the face and shooting pains and in like a vibrating electrical feeling up inside and just all kind of stuff. It made it very hard to get any rest. But
So that's a
now,
lot better.
oh my goodness, it's like night and day.
Okay.
I can sleep like almost like a normal person now.
Wonderful.
So I still have to wake up and reposition a lot and move just to kind of get it just at the right angle. So,
Yeah.
So.
Well, you talked about being full of shit. I know I'm not supposed to say that word, but when you're constipated, you're full of. But so, how's your bowels?
They are so much better.
Do you go every day now or no?
Yes.
Okay. Great.
Every day.
Great.
And
That's going to make you feel better
yeah.
too, because you're going to get detoxifying everything better.
yeah. And you know how you talk about the brain toilet?
Yeah.
I can attest to that. Because your brain was like, you'd be like, I don't understand this. I can't read this contract. I can't figure out this checkbook. I can't figure out, what button to push on the computer screen,
Yeah.
And I was always getting a family member to come and help me figure out basic things. And I'm doing so much better.
Awesome.
I feel human again.
Oh, great.
Thank you.
Great.
So.
Great. Have you done any teaching since we've been?
No.
Okay.
No.
But the way you're
usually-
articulating, I would think
Yes.
like you would have a much easier time doing it just by the way you explain things. I mean, it was.
I'm
It
going to
seemed
be able to teach next year.
Okay, great.
So, yeah, I called my old boss and I said, reserve me a class next year. I'm coming back. So.
Even from the get-go, you probably, once we figured out what was wrong, you probably like had hope restored, I bet. Even from the first visit, just knowing that there actually was structural things that were wrong. And like your jugular veins were compressed, so that's why you had the intracranial hypertension. Like you actually still have some intracranial hypertension based on the test we did, but it's definitely getting better.
But it's more coming and going, and now I know what body position to get in. I have to lay on my right side, tuck my jaw, look slightly to the left,
Yeah.
and then I can get it to lower again.
Yep.
And it will clear up in about 15 minutes. It'll drain enough, and then I'll be like, oh, I can think straight again, and then I can get up and continue. So I do have to take breaks during the day.
Is there any symptom, just so I know, because I haven't seen you yet today, so I'm just seeing you now. Is there any symptom that you first came that isn't getting better, just so I know? Or do you feel like the 20 symptoms you had, 20 symptoms are getting better?
I would say all the ones from the neck are getting better.
Okay.
I still have one mid back that's like shooting pains around, but all the instability up here is really getting a lot better.
So maybe at some point we might evaluate you for that. Maybe.
Yeah.
But you ready to get treated?
I am.
Okay.
I am ready for all the pokes.
Thank you so much for sharing your story. Appreciate it, Snow.
Well, thank you. And thank you for making such a life difference for me. And
Appreciate that.
on a side note, I'm so glad I found you, not just for me,
Yeah.
but I have Ehlers-Danlos and my daughter has it. And so now she knows where to go and what to do.
No, appreciate that. I was just thinking, I know, we got to get going but I didn't talk to you about, like during this interview, about your convergence thing. So, you remember you're saying like the pool, in other words, since we've been treating you, did anything change with your eyes, or that's like still
the vision.
Yeah, is anything change with the vision or no?
Yeah, I've got some warped vision.
Yeah.
And I see multiple images.
Yeah.
And
Were you the person who said to me, Doc, I see 5 of yous?
yes,
Oh, you're the patient.
I see the cluster of your face.
Because
Yes.
when I saw your original things, I said to you, because it wasn't on the board that you had blurry
Yes.
vision. So I said,
Yes.
I've told that story before because it's just a funny story. So I said, usually when you have these results, you see blurry vision or double. And I think you said to me, Doc, I see 5 of yous.
I see 5.
Oh, so you're the one. So,
Yeah.
So it's still early in our care of you. So is the blurry, is all those things, is it exactly the same? Is it worse? Is it better? Like how many of me's do you see right now?
Well, I still see a cluster of
Okay.
you.
Okay.
My eyes
Are they
used
all
to
good looking?
Fight back. Oh, yeah.
Okay, good.
They used to fight back and forth as to which would be dominant, and I think it's because like the speed of the information going to the brain was different.
Yeah.
But
Has it changed? Or
I'm not quite
okay.
sure. We'll
So
have
maybe
to
the
watch
vision.
that.
So you're basically saying the vision is still the same.
It's still
Okay.
the same.
Okay.
Yeah.
Because I just think because there's lots of people who have chronic problems and the doctors will tell them, there isn't a cure per se, and I just find it's just interesting when the brain pressure goes down. At least then the body has a chance to repair some things, and it may be that what caused the problem is starting to get better, but there still needs to be a lot of like occipital nerve repair, optic nerve repair, so.
I think I will have better convergence.
Okay.
So maybe at some point I will have fewer images.
So maybe at a later date we could,
yeah.
if that does happen, we'll do another interview. But yeah, I just wanted to, because I forgot to ask you about that. So if you're ready, man, we'll go do your next treatment.
All right, time for the pokes.